Hi all. Today in this video I am going to discuss a very common problem in our OPD, which is unconsummated marriage. So this is a typical couple who comes to our OPD. The husband is around 30 years, the wife is around 27 years. They are married for 3 months. Unconsummated marriage is a term where the couple has not been successful in having a penetrative intercourse. They come at variable times. They come at even 15 days after marriage, and there are couples who visited us even 11 years after marriage. So whenever a couple comes to us with unconsummated marriage, we just first give them comfort. So I am going to take you through as to what we do in our OPD, and this is actually a cramped video. I mean, these sessions usually take days to months for treatment, but I'm going to try and cover everything in this video. So it will be like a quick recap. So this is more like a highlights rather than the main picture itself. In the period of the IPL, I think these highlights will help you understand this problem. So we go back to unconsummated marriage, where the man is able to get an erection or sometimes not able to get an erection, but the penetrative intercourse has not happened. So coming back to our couple, married for 3 months, the husband is working abroad, so he came for his marriage, and now it is time for him to go back, and he also knows that the wife will come back only after 6 to 9 months. So on one side in his mind there is a doubt whether I will be able to do it or not. On the other hand, he also feels I am going to go back to my workplace. Now my wife will come back after 9 months, so I am leaving a work or a task uncompleted. So there are so many stress related things in his mind. Going deeper into the history, this couple started evaluation at the first month itself. That is, even after 1 month of marriage, they started going to the doctors. So when he went to the doctors, each person gave him some opinion, different opinion. Because of this, the couple was totally confused. So some of the doctors had given him the idea of a surgical option. Some have given medical option, and there are other options also like shock wave therapy, etc. So when a couple or when a man suffers with this problem, how to approach this problem? So the first thing is, see whether the man is a fit or a normal person, and whether he has any other problems like diabetes, etc. And then also inquire to him about his erections. So most of the times, even when the investigations are not okay, these couples, at least 80%, usually become okay with treatment. So the good news is, at least 80% of the couples improve. So only 20% require additional treatment. But is this treatment easy or difficult? The treatment is actually easy, but because of external influences, the couple usually takes time to improve. So this is what the most typical situation which we face in the OPD is. They have visited many people. They come to us as a last hope. They have only 50% hope in us, and they are also of the idea that maybe this problem will become okay or not okay. I really don't know what. So with this much amount of stress and confusion in the mind, they walk into our OPD. So when we receive the patient in the OPD, we usually immediately understand. Our team is usually seeing these patients, and on seeing the patient's face, on seeing the history, we immediately identify the problem, and we first comfort them. We tell them that there is lot of treatment available. If you cooperate, if you listen to the treatment, then things will become better. So this is the first hope we give. The next thing is, what we do is, we do a detailed history and a physical examination of the husband, and we also request the wife to be evaluated by the gynecologist to understand if there is a real problem on the wife's side. So the word real problem means only a very few percentage of women really have a problem in the vagina. That is, there may be a tight vagina, or there may be some congenital problem, which is a very, very rare situation. Most of the time it is fear and anxiety. So coming back to the male, in our patient, he is a 70 kg man, and he is a normal fit person going to the gym regularly. He is hale and healthy. That means there is a very least likelihood of having some problem. What could be the problem? The problem could be a reduced blood flow in the penis. It can also be some changes in the hormones, etc. So our patient also has gone to other doctors previously, and they have done a penile Doppler, which showed a very, very low blood flow and also some venous leak. So when our patient saw this report and he went to a doctor, they also started on medical treatment. So medical treatment is almost same in all the places. So wherever to whichever place he goes, the drugs are the same. So there may be 2 additional drugs on this side, or there may be 2 drugs less in the other prescription, but usually the medicines are similar. Then how to interpret this report and how to guide this couple is the most important challenge which we face in the OPD. So what is the challenge? The man is very strong and he believes that his blood flow is less, and he also says my penile Doppler itself is so poor, my medicine also is not working, then how do I proceed? And the wife is also telling, I really don't know how to manage this situation. I am able to cope up with the situation, but I have my own doubts. Already my family members are asking. This is what is the situation in the couple's mind. So when we saw the penile Doppler report, we noticed that this penile Doppler was done with the tablet, and the velocity, that is the peak systolic velocity, which is the input of the blood into the penis, was less. So there are some important points to note here. A penile Doppler is a test which assesses blood flow. Most of us know this. Penile blood flow is assessed only after a injection. There are many centers where the blood flow is assessed even after giving a tablet, but unfortunately that is not the test for diagnosing arterial insufficiency. That means whenever we have to tell that this person has a reduced blood flow, we have to do this penile Doppler with an injection. So the next question is, when somebody walks into our OPD, do we do this test? No. We first take the history. We take a detailed history. We have a dedicated andrology counselor who guides the patient through this history, and he identifies specific points. How is his confidence? How is his interest? How is his stress level? All those things. And also we have something called the erection hardness score, where we ask the patient and the partner how is the grade of the erection. So based on this and based on the physical examination, we come to a fair idea that this is the possible problem. Next thing is, whenever we ask the patient how is his erection, what is the grade, if the patient says that the grade is good, usually it's a grade of 1 to 4. 4 is the maximum hardness, 1 is the least hardness. So whenever the grade is 4, it means that the penile Doppler was not done in the right situation. That means the blood flow happens in the penis only when it has to be erect. So if the blood flow is assessed when the penis is not fully erect, that itself means that the blood flow is less because of that problem, and it is not because of a blood flow issue or a reduced size of the artery, etc. So the first thing to note here is, penile Doppler should be interpreted only when the injection test was done and the penis at least was hard enough to do the test. So whether the penis is hard or not, the ultrasound can actually pick up the velocity, that is the peak systolic velocity, which means how much blood is entering. However, if the penis did not become hard, it only means that there was no enough blood flowing into the penis, and maybe at that level there was a venous leak also, which is escape of blood from the penis back into the circulation. So the most important point to note here is, this test is done with an injection and the blood flow has to be there, that is the penis has to be erect, then only we can label this as a real problem. The next thing is, even in the injection, there is something which is called as papaverine, which is routinely used across centers. Sometimes this is not enough to give an erection for various reasons, which we will discuss sometime later. But whenever we use something called papaverine, it may not be the full dose, it may not be the full drug. We may require something else, which is usually a bimix injection, which contains 2 drugs. One is papaverine, one is chlorpromazine, or we do something called a trimix, where we also add alprostadil. So these are the drugs which really produce the correct blood flow, and if the mind is also very stressed and not relaxed, then also this can cause a problem. So whenever we evaluate a male patient in our OPD, we mainly go by the history, the masturbatory erections, the erection which he mentions during our assessment, and we also do something called the office erection test, where we give medicine and ask the patient to self-stimulate and show us an erection, or we give an injection and assess the blood flow for ourselves. So these are the things which we do. We don't rely only upon a penile Doppler. So this is the most important point which we all have to note, that whenever the penile Doppler was done with anything less than bimix injection or at least papaverine, please don't go by that report. That report is only 50%. That means you should not be worried. So in this couple, when we did the erection test, he had a very good erection, and he was actually very relieved. He immediately noticed that yes, what the doctor is telling is probably now I am able to relate everything. I am getting a good hardness, but I am not able to maintain it because I am not confident on myself, and my wife is also now losing the confidence and she is anxious or fearful about the pain during penetration. So this is where the role of our psychologist and counselor comes. We talk to the patient, it takes lots of time. That's why I told I am going to give a lot of information in a quick time. So it takes days, and people slowly they start understanding the problem. They start relating what we say to real life, and they slowly become better. So in our couple also, we gave the medicines, we give them lot of confidence and self hope, and they started noticing the erections are improving, and then it was a happy ending. They had a good penetration, and the husband was also very happy. He left abroad. So in this case, what I want to tell is, whenever you see a report like this, or whenever you have multiple suggestions, always visit an andrologist because they are the best persons to do this treatment. A urologist specializing in andrology, or an andrologist who is an expert beyond urology doing a fellowship, etc. These are the main centers where these things are done in this order, and they see lot of patients like this. So we really know how the situation happens and how it works. So what is the bottom line? The most important things are self-confidence, reduce stress, relaxation, avoiding anxiety, and then trusting the treatment and continuing the treatment without expecting a result in the very quick time. So results will happen, but usually it takes time. The one more thing is, once the result came, it has to be sustained. So these are the basis or the factors on which we treat, and most of the couples, at least 80%, become successful with medical therapy. So in this particular case, this was the main points which I wanted to highlight. See you soon in another case situation. Thank you.